Immunizations. They protect millions of Americans from serious, sometimes fatal diseases. Ensuring people get the vaccinations they need requires the cooperation of stakeholders throughout our communities. It's called the immunization neighborhood.
The immunization neighborhood can best be described as the 3 C's: collaboration, coordination, and communication among immunization stakeholders who are dedicated to serving the immunization needs of their patients, but at the same time protecting their communities from vaccine-preventable diseases.
2016 marks the 20th anniversary of the immunization program that supports the important role of pharmacists caring for patients across the lifespan. The National Certificate Training Program on Pharmacy-Based Immunization Delivery was created by the American Pharmacists Association. This program gives pharmacists the knowledge and skills to implement immunization services as valued members of the public health community.
At APhA, we're focused on gaining consumer access and coverage for pharmacists' patient care services. The immunization programs we've developed over these 20 years do precisely that and have played a major role in advancing public health. In the process, we've changed patient perceptions of what pharmacists have to offer in the delivery of direct patient care.
There are now almost 300,000 trained pharmacists authorized to administer vaccines in every state. According to the Centers for Disease Control and Prevention, pharmacists now administer approximately 25% of all influenza vaccinations.
The community pharmacy plays a critically important role for patients. Pharmacists are the most accessible healthcare provider and are often the first point of contact for many patients, whether or not they're coming in to get a prescription filled or whether they're coming to ask advice about something that's happening with them or another family member. Because of our knowledge and accessibility, this really makes the relationship between the pharmacist and patient unique, and the pharmacist plays a very important role as a member of the patient's healthcare team.
Pharmacists' authority to administer vaccines recommended by the CDC beyond influenza is expanding as well, making the work of pharmacy-based immunizations a year-round activity. The Centers for Disease Control and Prevention considers the APhA Immunization Training Program the gold standard for quality and content. Pharmacists also serve as information sources for their communities and collaborate with other members of the immunization neighborhood to improve the quality and accessibility of care.
Having pharmacists as partners in the effort to protect the public against vaccine-preventable diseases has increased access, improved immunization rates, and provided a springboard for other patient care services.
Even if the patient doesn't get the vaccine with me, I can provide them education and information, and they can go back and get the vaccine in their physician's office. I think the important thing is that we raise the immunization rates for all of us so we can have a healthier community.
Continuous growth and ongoing success take dedication and innovation. The APhA Immunization Champion Awards recognize those who have made it their mission to take pharmacy-based immunization to the next level.
It's so very important that pharmacists take an active role when it comes to immunizations for the health of our patients.
It helps me contribute to society, it helps me contribute to public health, and it's something that I'm very proud to be.
I can say now, after 20 years, there's no question that immunization has made a bigger impact on our profession's future than any other development that's occurred in the last 100 years.
Pharmacy-based immunization, protecting patients, families, and communities, and ensuring the success of the immunization neighborhood.